I do want to take this time to thank Doug and Bill, the AGA, and the Rome Foundation for inviting me. I'm grateful and humbled because I always imagined as a GI fellow someday speaking to the AGA. I never could have imagined, though, the talk that I would give would be one that I'm presenting tonight to you. I thought it would be about colon cancer, maybe even IBS, maybe even Barrett's esophagus. Now, if anybody's sitting in the room and sitting back and wondering, what they're going to get, I just ask you to be patient for my presentation. I'd like to also add, for those who are attending this meeting, not only was I asked to be a speaker, but I was an attendee at the meeting, this morning and this afternoon. And I have to tell you, it's too bad that there weren't more people in the audience, because as a private practitioner, I found out that the #1 diagnosis that I deal with on a day-to-day basis is functional bowel disease, by far. And the second thing I really pride myself on is the patient-physician relationship. So this is a great combination of both, and an amazing collection of people, and I'm honored to be here. Now, for those who don't know, I am legally blind and was diagnosed with a condition called optic nerve atrophy, which is why I'm humbled. Because 11 years ago today, I was sitting at home just praying that someday I would have something positive to share with anybody that would listen. Now, what optic nerve atrophy left me with is central vision loss, which means I can't see anything right in front of me. Now, what that means to everybody in the audience will think, if anybody is bored or disinterested and wants to get up and leave, I'm not going to see you walk out of the room. So at the end of the day, when my wife says, "How was it?" she doesn't have to know that the room was empty. I'll just say that everybody was speechless. So that's between us. Okay. Now, if some of you are wondering how you can relate to my story, I'm going to make several challenges tonight. And the first challenge that I'm going to have is try to identify, sit back and identify. I don't have any PowerPoint presentations, but try to identify with my story, because I think you'll find that over the course of the next 3 hours, about 40 minutes, that we probably have more in common than not. And I know for a fact that many of us in this room are spouses, parents, clinicians, coaches, but most importantly, I know many of us have dreams. And that's where I'd like to start my story. I grew up in Queens, New York, and Brooklyn, New York, to a very loving family. And growing up, I loved athletics and sports. And in 1969, the first event that occurred that influenced me immensely was a team called the New York Mets went from last place to first place. This was a team that had no respect by anybody in the league. They went from last place to first place and wound up beating the Baltimore Orioles in the World Series. And I remember being 8 years old and running out of school, because baseball then was playing during the day, not at midnight, jumping in the car where my mom was waiting for my sister and I, cranking the AM radio because that's all we had, and then sitting on the edge of my seat listening to the ball games going home. Now, you could sit on the edge of your seat then because there were no seatbelt laws. So you were able to there was a day then. And I said to myself, this is what I want to do in life. I want to someday play baseball for the New York Mets, my hometown heroes. Now, as I say this, because it's being videotaped, we had a pulmonologist at our hospital once tell everybody at the hospital, "Did you know Ray played baseball for the New York Mets?" So I had to make it clear that I never played ball. I was only 8 years old at the time. But that was a dream that I had. And then 4 years later, the second event occurred. In 1973, yes, the Mets made it back to the World Series, but they didn't win. But in 1973, when walking home from school, I was struck by a car and shattered my right leg. And with that was shattered any dreams of playing any professional sports. And as a 12-year-old boy, and then ultimately a teenager, I found that very devastating, because that's all I wanted. Those were my dreams. And then the third event occurred in 1975, while sitting in the hospital the night before one of my operations. And yes, there was a time when you could be admitted to the hospital for an elective operation the day before, if any of you don't remember that. But I was sitting in the X-ray department at the Hospital for Special Surgery in New York City. And a group of physicians walked in, and we all know it from the teaching hospitals. There was an attending, residents, and medical students. All the white coats came in. And they introduced my case, and they said, "Everyone, this is Ray Miss, and tomorrow he's going to have," and all I heard was yada, 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 blah, blah, blah. Does anybody have any questions? And as a 15-year-old, I I just sat back. I had no idea what to do or what was going on. And then they looked at me and says, Ray, do you have any questions? And I actually looked up and I said, no, I don't. I didn't know what to ask. I was a teenager. And the entire group walked out of the room with the exception of one physician. And there was a Dr. Feta who wound up being a resident. Now, at the time, I was a 15-year-old skinny kid sitting in the waiting room with gym shorts. And back in the 70s, the gym shorts were running pretty high. So I was showing a lot of leg in the waiting room. And Dr. Feta sat down next to me and said, Ray, let me show you what we're going to do tomorrow. And he took a pen out of his coat pocket, reached over and put his hand on my knee and began to draw the operation. And immediately, I felt the power of his touch. I sat there and said, this is amazing. This is what I want to do in life. And any depression or disbelief about ever playing baseball again kind of escaped me at that time. And I was motivated. I remember going back up to the room telling my folks that this is what I want to do in life. I want to become a doctor. I want to help people. And I'd never forget the power of Dr. Feta's touch. My parents were probably focused in on the operation. I can't even remember what their feedback was. But I enrolled at Siena College in upstate New York, and I set my visions on medical school, pre-med. And after my first semester, coming back from Christmas vacation, my advisor, Dr. LaRose, sat me down and said, Ray, your grades aren't going to be good enough to get into medical school. And I remember sitting there saying, this is my dream. So I told him I didn't want to give up on that and to just give me a chance. And what I did is I wound up doing volunteer work and doing research with the doctors that operated on me in New York City. I buckled down and brought my grades up. And to the amazement of my advisor, I wound up getting multiple medical school interviews. Unfortunately, I was waitlisted at all of them. Not to be denied to give up, I enrolled at graduate school at St. John's University, not too far from where Doug grew up. And I took a graduate program in biology. I went to school full-time at night, and I wound up working full-time during the day. And I excelled academically. And I reapplied to medical school, and I re-interviewed at all the same medical schools I did the year before. And I remember walking out of the osteopathic medical school up in Maine at the end of the interview, and a Dr. Novotny looked at me and says, hey, Ray, if you don't get into medical school this year, do you have any plans? And I looked him right in the eye and I said, I guess I'll see you again next year. Well, within 5 days, I received my acceptance letter, happened to be Good Friday, 1984, and I was once again on my way. I wound up marrying the woman who took care of me after one of my knee operations, Margaret, and she actually had a philosophy that she would not date or marry a patient, a fireman, or a doctor. And I did put out fires in Boy Scouts. So, and I remember telling the story once, and somebody said, Ray, they sent Boy Scouts into fires in burning buildings in New York. I'm just talking campfires. But I think I hit the trifecta with all three. But I met the woman of my life, my best friend, my wife, Margaret. I did a GI fellowship in Michigan because I wound up finding that that was my love. My first rotation out of medical school, I worked with a bunch of gastroenterologists in New Jersey. And you know, they were fun, happy-go-lucky, well-respected. And I looked at them and I said, you know what? They look like they're happy and they enjoy what they do. And that was important to me if I was going to be doing this the rest of my life. If they're happy at work, I hope that they're happy at home. And I became a gastroenterologist, did my fellowship, and then eventually settled in Rhode Island. A few months after we settled in Rhode Island, we celebrated the birth of my first daughter, Shannon. 2 years later, we celebrated the birth of my daughter, Olivia. Life was good. In the year 2000, I was selected one of the top doctors in the state of Rhode Island. And I remember hearing that news, and I remember crying because I remember how hard I fought to get into medical school, and I was just so happy I didn't give up on my dream. Well, right around that time, I started having some health issues. My family and I went down to Orlando, Florida to Disney World. And what happened was that coming down in the airplane, I noticed that my hearing was off a little bit. And I remember everybody telling me that, oh, it must have been the pressure on the airplane, maybe you have a virus. And when I got back to Rhode Island, I realized that my hearing was somewhat compromised. And I did what every doctor, well, at least what I thought every doctor did. I obtained hallway consults. Maybe some of us have done that. And I asked some of my colleagues, you know, what do you think is wrong? And eventually wound up having tubes put in my ears. It was thought that I had fluid behind the eardrum, and if they put tubes in my ears, that I would hear better. I remember being told as I was being wheeled in the operating room, hey Ray, once you take your cotton out of your ears tomorrow, you are going to hear so much better. Well, that day came. I went outside figuring I'm going to hear the birds chirp, appreciate the outdoor sounds, took the cotton out of my ears, and I could hear no better. And I remember being devastated. I go, geez, what happened? And I eventually went for official hearing testing and was found to have permanent bilateral hearing loss. I remember being devastated. I remember crying to my wife, like, I can't believe this is happening to me, that this is going to be permanent. I'll never be able to hear our kids sing. And you know, if you ever heard my kids sing, it's not really a bad thing, but that's besides the point as a parent. But I went and I got fitted for hearing aids from Beltone, which I still wear today. And I always say I put them in and I'm wired for sound, and I was back on my journey. So life was good. In the year 2001, my wife and I had the ability to go down to Florida to see my other beloved team called the New York Giants. And they were in the Super Bowl that year. And my wife and I went down to Tampa, Florida. We get off the airplane, and I noticed in January of 2001, I had a light sensitivity. And I wasn't sure what was up, and I said, you know what, I forgot my sunglasses at home. It's January, that's all it is. And kind of the joke is, too bad I didn't lose my vision before the game, because as a Giant fan, it was a terrible game to sit through. But the Giants lost. We went back home. My father came up to visit us a few short weeks later. My mother and sister went to Italy on a mother-daughter trip that they had planned. And my father had been suffering from Parkinson's disease and some early dementia, and he really couldn't take care of himself at home. So this was a great opportunity for him to come up to our house in New England and spend a couple days with us, Margaret and I and the kids. While he was in our house, he had a cardiac arrest. And we kept him alive for a couple of days, and my mother was able to fly back from Italy. And I guess the gift was, he died holding her hand. We brought his body back to New York, and where at the funeral I asked my mom if I could eulogize my dad, because my dad was a great man. He worked 2 jobs to support my sister and I think people needed to know in the church what a great father he was, what a great person he was. So my mother gave me permission. I wrote the eulogy with the help of my wife. And in the church, in March of 2001, I realized as I took the eulogy out, I had a hard time reading it. Now, I attributed that to the fact that I was grieving my father's loss. I was tired and fatigued, and I will be turning 40 years old in a couple of months. And what do they say? When you turn 40, you need eyeglasses. So that's all it is. But I couldn't read the eulogy in church, so I had to hand it off to my cousin, who did a great job reading the eulogy. Spent time with my mom, went back to Rhode Island. I was back on my way. Well, in June of 2001, one day I got up to go to work, got in my car, pulled out of my driveway, and suddenly I realized I couldn't see down the road. And I'm embarrassed to say this today, that I drove to work that day. And by the grace of God, I didn't hurt anybody else or myself. But I just knew along that drive, which was 7 miles long, that if I could just get to the hospital that day, this was at 6 o'clock in the morning, then it mustn't be a serious problem. I gripped the steering wheel. I was sweating the whole way, and I got there, but I knew I couldn't drive home. I canceled my day. My wife and I went up to an ophthalmologist up in Providence and had a thorough evaluation. And after the evaluation, the doctor walked back in and said, Ray, you're legally blind, you can't drive, and you can't do procedures anymore. Now, it was an obvious thing to me as I sat there, but I was also in shock. The physician walked out of the room, and all I could hear was my wife crying in the background. She knew we were in trouble when I couldn't read the big E on the eye chart. This was the first time she realized how bad this really was. And while she was sobbing, I took out my life's story out of my back pocket, because we all have one, and I remember flipping through it. And I don't ever remember reading this chapter. I wasn't prepared for this. How were we going to go on? We get in the car on the way home, and my wife said, Ray, the doctor said that this could be hereditary. You have to be a good role model for our children. And I remember getting very angry as a father saying, this can't happen to my children. I didn't know to punch the dashboard or what. I mean, how could I be a role model for my children when I didn't even know how to deal with this myself? It was just too fresh. 2 days later, I turned 40 years old, and my wife and I tried to put a smile on our face. Anybody from New York, we have Carvel cakes. My wife decorated the table. We sang, danced around the kitchen table like we normally did, and then put the kids to bed. And from that point on, it was to see doctor after doctor to try to figure this out. And I remember having a spinal tap a few days later. And I remember coming home having a terrible spinal headache. And what reminded me of all that was I couldn't get out of bed the next day to go to my daughter's first grade graduation. And that bothered me as a father. I wasn't going to be able to be there, but I couldn't move out of bed. I get a call from my neurologist a few hours later saying, Ray, we think that you have cancer. We want you to cancel your upcoming trip. And then like an hour later, the doorbell rings, and my wife brings me up a bouquet of flowers from my neurologist. Now, it can't be a good thing when your doctor sends you flowers. I know we're talking about the patient-physician relationship, but I know it wasn't a good sign when I was getting flowers from my doctor. Well, I went to work every day, and I couldn't read my charts, but I had my office staff read them for me. I felt if I could keep my head in the game as I was going to doctor's appointments up in Boston, New York, and eventually out to the Mayo Clinic, that I would feel some sense of worth. I was referring all my endoscopies to my associates, that they would do them for me. And then eventually went out to the Mayo Clinic, where they discovered I was exposed to Rocky Mountain spotted fever and histoplasmosis, and ultimately was treated, where I stabilized. Now, as all this was happening, I continued to go to work, as I said, but in February of 2002, I realized that my professional relationships were dissolving, and I was soon going to be practicing on my own. And I remember sitting back saying, how am I going to be able to do this? I love what I do. I love my practice of medicine. I also had a responsibility as a father and a husband to my family. I also had a responsibility to my patients. I didn't want to give up. People said you wouldn't, couldn't, and shouldn't practice medicine. So I thought back of an appointment I had with an optometrist at a Yale New Haven hospital on Christmas Eve of 2001, who said, leaving his visit, Ray, it's just a matter of when, not if you could ever do procedures again. And I guess I always held on to that. And I always had this flame of optimism burning in the back of my brain. And I remember calling him up one morning saying, Bill, this is Ray. I need to know what you meant by that. This is my situation. And I could hear him on the phone saying, Ray, I don't think he knew what he meant when I walked out of that appointment. But together, we came up with this idea that if I could find a video monitor that would be able to correct my vision loss if I sat close enough to, that I could maybe someday get recredentialed. Well, over the course of the next several weeks, we found this monitor. Well, now that we had a monitor, the question is, how do you recredential a blind guy to do procedures? Now, if any of you guys believe in faith or a higher power, I received a phone call right around this time from the Rhode Island Medical Society, for which I had been working with because of my low vision. And they said, Ray, you're not going to believe this, but we just met with this group out of Colorado that recredentials people with different difficulties. And they were kind enough to spend time with us as we reviewed your case with them. And they said that, well, if Ray has adaptive equipment that was deemed appropriate, and if he did multiple procedures, and they came up with a number of 30 within a 2-week period that was proctored, and met all these other criteria, we would deem him a safe practitioner. Well, we had a monitor. We now had some criteria to go by. The question is, how do you find patients? Well, word on the street got out that I might be recredentialed. And the amazing outpouring of my patients and staff were, Ray, don't send me to anybody else. I'm going to give you 6 months. I will be your first patient. People were volunteering. And within a 2-week period, 60 of my patients volunteered to be my first patient. On April 18th of 2002, I was deemed a safe practitioner, and I've never looked back since. Now, early on in this process, I was drained emotionally, physically, and spiritually. People said I wouldn't, couldn't, and shouldn't, but I so yearned to get back. Not only, to stay healthy, which was the first goal, so I could stay alive, to be with my family, but then to function in society. And I became a gastroenterologist for a reason. I wanted to continue to practice. But early on in this process, I was drained. So what I did is that I relied on the strength and the courage of the people around me. Early on in this process, I learned in a 12-step recovery program a prayer called the Serenity Prayer. The Serenity Prayer, for those who don't know, says, God, grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. Well, what were the things that I couldn't change? I couldn't change my hearing loss. I couldn't change my vision loss. And you know what? I probably couldn't change some individuals' opinions that maybe I shouldn't be practicing medicine. But what could I change? The biggest thing I could change was my attitude. My attitude was the biggest thing, and I always look at my attitude as the fine-tune button. And depending upon what my attitude is, that will allow me to see things more clearly. And I got to work on that on a daily basis. And I now have the wisdom to know the difference between the two things I can change and not change, which, you know what, helps me with my serenity. And that's a gift. Now, early on, I relied on the strength and courage of many of those around me. And I could sit here and tell you about the people that maybe turned their backs on me. But the reality is that the strength and the courage of the people who believed in me helped me get back on my feet. Because early on, I thought I was incapable, such as maybe doctors, patients, and friends. The first is my secretary, Susan. My secretary, Susan, sat through turmoil in the office as our office and the staff were spiraling out of control as my professional relationships dissolved. She didn't have to sit through a lot of the stuff that she did, but she was loyal and she was there for me and continued to read charts to me and has been with me ever since. I have a nurse practitioner, Jeanette. And Jeanette's been amazing because she was offered other jobs. But she came to work with me, the visually impaired, hearing impaired gastroenterologist, and we make a great team. The strength and the courage of my patients. Even to this day, I will have patients come into my office and say, you know, my brother, my father, my neighbor wanted to know, why do you go to the guy with the eye problem? And they always do this. Why do you go to the guy with the eye problem? And to quote one of my patients, said, you know, Ray, I told him I go to Ray not because of his low vision, which could be corrected with technology. I go to Ray because what's behind his eyes and with his heart. And I share this at every one of my talks. I relied on the strength and the courage of my best friend, and that's my wife, Margaret. My wife has had to accept the driver's seat in life if I was forced into the passenger seat. She's the rock that I can lean on, and has been there with me along the entire way. And we look at other relationships and how relationships kind of sometimes end and stuff, and we kind of count our blessings. And it has been easy, but we've grown closer together, and that's been a gift. Now, as I stand up here, I'm not looking for sympathy. And if anybody in the room is old enough to remember a group called the Beatles, maybe a few.
Oh, yeah.
I do. But Paul McCartney wrote a song, and I think it was Paul McCartney, Let It Be. And in the song, Let It Be, there's a verse, although the night is cloudy, there's still a light that shines upon me. And ladies and gentlemen, although I have had my vision loss and my hearing loss, I consider myself a very lucky man. Since I lost my vision loss, I've been invited here to speak. I was the chief of our department of gastroenterology at the hospital. Since I lost my vision, I was renamed one of the top doctors in the state of Rhode Island in 2007. A national publication called Best Doctors of America included my name in it in 2009, 2010. Since I lost my vision, I took kayak lessons, have played softball again, although when they're choosing teams, I'm still with the toddlers against the fence. So that's something I've had to accept, and I'll deal with my therapist at another time. But as I say all that, you know, one of the greatest gifts I received since losing my vision is resuming my daughters as their coach in softball and soccer. And although I can't see them score a goal or get a base hit, as a parent, it's so important for me to be on the same field as them. A couple of years ago, when I resumed coaching after my visual issue, I actually wound up calling all the families the week before we started our season. And for those who didn't know in the community, I explained my situation to these individuals, and I said, please, if you have any feedback, please give me a call. Well, the season ended, and I have to tell you, half of the people that I went up to, because I asked for feedback, after the season from families, half of the individuals had no idea that I was legally blind. And then I said, geez, who has the eye problem, I wonder? But that's another discussion. Although my life is good, it takes work. And I remember in 2003, 2004, going through a rough period because I was watching on vacation all these other fathers drive the cars, unpack the cars, clean them out there, and I couldn't do that. And I remember thinking and feeling sorry for myself that, you know what, I may never be able to teach my daughters how to drive a car. Now, many of my friends tell me, Ray, count your blessings. But maybe it's a testosterone thing. But I felt like, geez, I'll never be able to teach them to drive a car. And with insight and reflection, reading and talking about it, I realized I may not be able to teach them to drive a car, but hopefully I can teach them a few other things. The first thing is that nobody in this world is perfect, and that's okay. Life is progress, not perfection. The second thing is, no matter how heavy the weight is on our shoulders, the ground below us is not going to crumble. And then the final thing is that don't fear your future. Now, in the summer of 2001, I feared my future. And I remember one of my colleagues coming up to me saying, you know what, Ray, when we recruit some sighted gastroenterologists, who's going to send their patients to a blind guy? And I remember getting very angry inside. And I kept on saying, well, I'll tell you who. Somebody that's going to do what's right for the patient, and I'm going to make this work. So in the summer of 2001, I suddenly changed my focus, not on my disability, but on my abilities. In the state of Rhode Island, there are about 65 other sighted gastroenterologists that do what I do, and I needed to stand out besides my vision loss. And that's what I directed my focus. So when we talk about the patient-physician relationship, my role now as a physician for what I learned as the patient was this. I cleaned up my doctor's bag and of course let the stethoscope in there. But I worked on some of my other tools, and those were my other senses. And I knew how to kind of work on that. Look, listen, touch. And many will say, geez, Ray, with your low vision, I think it's very important to use your eyesight. And some of us were talking during the cocktail hour how I learned over time that although I can't see anything in front of me, I look at my patients. I can't see their faces, but I look at them because I know that makes the patient feel more comfortable. I've had patients say, Ray, you must be seeing better because you're looking right at me. And I go, no, I'm not seeing any better. I can't see your face, but I know this is going to make you feel more comfortable. I know that's the right thing to do. I go to physical therapy, and my physical therapist will always tell me, he says, Ray, look at me now. He wants me to look over in the corner. Look at me now, and he wants me to turn my eyes so I can take my blind spot away because he wants me to see his facial expressions. But it takes work because I've trained myself over the last couple of years to look right at the patient. Listening to the patient, look, listen, feel. Listening is so important. Many of us know that if you're going to ask the questions, you should listen to the answer. I teach the medical students that are with me to say, if you ask the right questions, the patient will tell you what's wrong with them. Please stay around long enough to listen. And we talked about time, doing the right thing. With my hearing aids, my hearing deficit is negligible at this time. So I try to listen to my patients because I knew that was important to me as the patient. And feeling, the sense of touch. Now, when I mean touch, it's so important not only to look at your patients, but I put my hand on my patients. I sit on their beds. I hug my patients. I kiss the little old ladies. I shake their hands. I do that to the family members because I need to let them know that I'm a human being also, and I try to connect with them. It's not uncommon that I'll come home at night for dinner, and my wife and kids will say, I'll take my jacket off, and my kids will go, uh-oh, Dad was at it again. And I always tend to have old lady makeup on the left shoulder from all the hugs I give. But that's important for me. This is a new shirt, by the way. I just got it last week, if anybody's going to expect it. That's important. And then I think the other thing about touch is examining our patients. In this new technology age, and I love that expression today about the eye patient, because that's what it's coming to. We're being forced to spend less time with our patients. But it's to examine our patients. I can't tell you how many second opinions I will get in my practice to say, the doctor never examined me. The doctor never touched me. An example I can give is just a few months ago, I had a patient come in, I spoke to her and her husband, I sat on the stretcher, held her hand, and then I started listening to her heart. And immediately the husband said, Dr. Miss, my wife has never been examined like that before. And it struck me. And I kind of went back and I said, well, if you don't mind me asking, what happened at the last encounter? The doctor came in, asked us some questions, and then said, this is what we're going to do. We're going to do an endoscopy, a colonoscopy, and an MRI. And my wife still has pain, Dr. Miss. Well, when I examined her abdomen, we found the umbilical hernia. That was the source of her pain. So not only touching your patients to make them feel comfortable, but it's to follow through with our exams from start to finish. With my story, and I talked about my tools, I also try to inspire my patients, and I share with them my trials and tribulations. Now, St. Francis said we should be teaching every day, and on occasion use words. And I know I'm talking today, but many of my patients look at me as an example that if Ray can deal with this, I can get through this problem. But some people need to hear it from me. And I share some of my experiences of strength and hope to give them hope and how important that is. I share with people how important it is to validate their feelings. And I share with people how 11 years ago, when I lost my vision and I felt my life was over, when people used to tell me like, hey, Ray, God only gives you what you can handle. Hey, Ray, it can always be worse. I share with them that 11 years ago, I wanted to tell them, take your advice and shove it, because until you've been in my shoes, you have no idea what I'm dealing with. Now, I never said that. But that's what I wanted to say because I was hurting inside. But over time, with the help of others, I realized that every one of these individuals is right. And what I do, besides offering hope with my story, I try not to give false hope. But I try to teach my patients, as the patient now, how important the power of acceptance is. We talked about the Serenity prayer earlier. How important it was for me to accept my vision loss, my hearing loss. Even today, waking up and not seeing the alarm clock, important to say, okay, Ray, this is the way it is. Put your boots on and get going. I can't feel sorry for myself. And once I accepted my limitations and my problems, the road to recovery was that much easier. The second thing is accountability. How important the patient has to be, how important it was for me to be accountable in the treatment process. I call that ophthalmologist and optometrist at Yale New Haven. The patient has to take some action. I have to hold my patients accountable for some of the treatment. They need some responsibility. And that's the third part. We talk about acceptance, accountability, and then talk about responsibility. I felt the responsibility to my patients, to my family, as well as to myself, to try to get back on my feet and fulfill my potential. The patient has to take some responsibility in their treatment plan. I can't suggest something to them like with fatty liver disease and ask them to go exercise and diet, and then they come back and they're 5 pounds heavier. They have to take some responsibility. And then I talk to my patients about the power of passion. I have passion for life. I have passion for my practice for medicine. I have passion for my family. And because I have passion, it made it so much easier to come over all these obstacles. When people were telling me, you couldn't, shouldn't practice medicine, Ray, the passion that I have for what I do kept me going. And I wasn't going to be denied. I didn't feel I can go to my grave without trying to get back on my feet. And granted, it was my professional relationship dissolving, and I always describe that as the kick in the, that kick in the stomach was the kick in the pants I needed to get back on my feet because I had passion. And then finally, finding purpose in life. Those who kind of sit home and don't work, and those who are just feeling sorry for themselves, they're not fulfilling their full potential. And I used to think that my purpose in life was to provide a roof over the head for my family, put them through school, feed them, etc. But over the last 11 years, I found that my purpose in life is to find inner peace and serenity. And if I can find inner peace and serenity, being able to sleep at night, doing the right thing, then all those other things will follow. And I try to do that for my patient, spend time with them, do right by them. My patients know with my vision loss, I try harder than the other doctors. Because one of the things is being visually impaired, I can use it to my advantage. Not only do I try harder than most to do the right thing, because I have to work at it, that I also have my records reviewed regularly, so that keeps me honest on a regular basis. And some people say, well, aren't you angry now? It's been 11 years. But you know what? Hey, it's keeping me honest. I don't mind. And if it's proving to other people that I'm a safe practitioner, then that's what I have to do. And that's very important to me. And then finally, I talked to them about the power of courage. And courage, as you know, is being able to face your fears. And many of us fear change. Many of us fear disease. Well, we have to accept the fact that sometimes things happen. And once we accept that, and if you have courage, you can do anything. Now, as my talk comes to a close, I'd like to share with you and challenge you for a final time tonight that I'd like to challenge each and every one of you at your next patient encounter to try to see your patients more with your heart and less with your eyes. And I think you'll find that that patient, you, and the community will be better off for it. I thank you for your time and attention tonight, and I look forward to talking to anyone after the conference and seeing people tomorrow. Thank you, and God bless.